Welcome to the American Academy of Grief Counseling's program on crisis counseling and domestic violence. And in this, we're going to be looking a lot about crisis, those in the state of crisis due to domestic violence, as well as the grieving process associated with it. We're also in the beginning going to highlight what domestic violence is, as well as profiles of the abuser and an individual who is the abused in themselves. Domestic violence, also known as intimate partner violence, encompasses all types of couples. It doesn't just have to be those who are married, but it could be those living together, same-sex couples, as well as children or the elderly. It could be beyond just be beyond battery, but it can also be verbal as well as emotional abuse. While men can be abused, the most likely scenario and statistics show is most victims are women and children. 3 in 10 women suffer some form of violence as opposed to, in contrast to 1 in 10 men. Rape and violence against women and children continue to be a large issue globally in itself. Myths surrounding domestic violence include that battered women will overstate their case, they will display too much sensitivity, that they hate men or are looking merely only for revenge. The reality, though, is that most women who report are not reporting their first time being abused. It might be the third or fourth time that they finally had enough courage. Other myths involve the fact that the abuse is justified or that the woman was asking for it or provoking it, or that if it was truly that bad, then the woman would leave the actual relationship. Unfortunately, many societal views can also glorify and justify violence. Many patriarchal stereotypes portray men as dominant and women as submissive, as well as glorifying violence and anger as power tools for the strong themselves. Now, let's take a closer look at the profile of the abuser. And in some cases, you watching might be just looking to learn, but you might have abused in the past or be abused. And I think this is important to understand that while women can abuse mentally, usually they are males who are doing much of the abuse themselves. We're not trying to downgrade the fact that there are men who are abused. I think it's important to acknowledge that and not to disenfranchise that. But again, we're speaking more so with statistics. So let's take a look at some of the problems of an abuser and the mindset psychologically. There are various theories. There are attachment traumatic bonding theory, and this speculates that abusers abuse because of the fear of losing a significant other. And maybe in their past, there has been trauma of them losing a primary caregiver and they lost stability because of this. And they utilize abuse as a way to keep the person from escaping their relationship with them. Another theory is exchange. Exchange theory postulates that the abuser will continue to be violent as long as the reward outweighs the cost, especially in utilizing violence to maintain control. So as long as the reward and there's no consequences, they will continue to abuse. Intra-individual theory investigates various psychological and also neurophysiological disorders that also play a part why batterers abuse, beyond just behavior, but looking deeper inside the mind. Many abusers were also battered themselves. Maybe in their youth, they faced poor family conditions as children. They have anger and impulse control issues that might have been inherited or through observation. Many deal with addictions and also suffer from a variety of cognitive and emotional disorders. Many in their personality will demonstrate excessive dependency and possessiveness of a partner or a woman. Others have poor communication skills and can only really communicate and filter themselves through anger itself. Some have unreal expectations of their partner or their spouses, and that leads to anger outbursts. Others may see themselves as dominant and will set up rigid control patterns within the family that can never be violated. And looking at this, many men who abuse are characterized as jealous, impulsive, denying, depressive, demanding, aggressive, and violent. In addition, many suffer from also low self-esteem and they can form addictive habits. Many of these abusers will look to minimize the abuse, deny it, or project the battery onto the victim as if it is the victim's fault. Some abusers only abuse family members and are quick to forgiveness. Others have deeper antisocial tendencies, or they have personality disorders where they look to justify their acts. Now let's flip the coin and look at the profile of the abused. And again, not to disenfranchise any men, but usually it's a woman or a child that is the abused. And there are various other characteristics that are tied to someone who is abused. These characteristics are sometimes sought out by abusers who look for individuals that they can continue to abuse and to control themselves. Most who were abused in the past, and they may very well feel that that is part of life. It's part of the structure of how it occurs. Because of this, many of them lack low self-esteem as well as a lack of confidence, which makes them feel that they cannot make the situation better itself. Many women who are subject to abuse are also very dependent upon the spouse or the abuser. They're unable to escape. They have a fear of being stigmatized if they leave, or they're so isolated from anyone. They're unable to talk to anyone about their problem and to escape. Many times they confuse sex for love, and they also can sometimes have a misconception that it is their duty to fix the abuser. And if they leave, then they have failed in that particular mission. Now, when we look at the cycle of abuse, it starts with a period of tension, which is usually followed by a precipitated incident of violence, which then leads to reconciliation. And after that storm, there's a short period of calm until that tension again builds up and the same abuse recycles and that cycle of violence continues through. And again, due to sometimes purposeful isolation, many cannot escape that. So it's important to help the abused, especially as healthcare professionals and also behavioral health professionals. Upon any report of violence, counselors and healthcare professionals are required to report. If they believe the abused is key, it is essential and by law that this must occur. Most cases where reports of abuse occur are heard in shelters or when someone comes into the hospital with an injury or following an arrest. So many who report, though, are not reporting the incident for the first time. It's probably occurred well before. So it's important for those in social work or in healthcare, nurses, forensic nurses, or just licensed counselors to look for PTSD signs within the individual. How are they physically reacting to the interview with you? And it's important to listen with empathy, to allow the abused to express their emotion, and to be far from any judgment or skepticism about what they are saying. It's important to offer the victims alternatives, ways to find safety. Sometimes they don't want to leave immediately, and maybe intervention is needed. In other cases, They may need to be continually checked up on until more evidence can be collected, and they need to be called and see if they're okay the next day. Now, in cases of the abuser can sometimes go to counseling, and it can sometimes be successful, sometimes not. Usually anger management, but there's also a variety of other types of therapies depending on how deep their pathology is. Sometimes this can lead to reconciliation, other times not. So victims need to have a plan if reconciliation is not going to occur. And this is where counselors can help the victims form plans and have goals and the ability to achieve those plans through various short-term or long-term support, social support systems, as well as maybe necessary therapy for potentials who have PTSD or issues of depression, as well as psychoeducation against violence, so to help the individual and the abuser to find some sort of healing and ability to move forward from that. So AIHCP offers a variety of programs that can help those who deal with domestic violence. We have a crisis intervention specialist program, an anger management consulting certification, as well as the grief counseling program. Our number is 330-652-7776, and our email is info@aihcp.org. Now, if you are a victim of domestic violence or you know someone who is, the National Domestic Violence Hotline is available. That is 800-799-SAFE. Again, that is 800-799-SAFE. Our resource for today was the Gillian textbook with crisis intervention strategies, and a lot of what we discussed came from that resource. I'd like to thank you for listening and have a good day.